Friends, Romans, countrymen, how y'all doing? Listen, some of you probably know this, but some of you may not. I'm an RN, I'm a home health nurse, and I was just talking to a friend of mine, and it's kind of explaining how interesting home health can be. Because when you are a home health nurse, that patient's not coming to a doctor's office. You're not visiting with them in the hospital. You are on their terms, on their stomping grounds. You are where they are comfortable. I'm saying you're going to get them just like they are. And sometimes that creates some pretty interesting circumstances. I was thinking about probably the strangest, if not probably the most frightening home health visit I've ever done. I thought I would relay this to you. And this is completely true. I went to this house in the not so best neighborhood. That doesn't bother me really. I'm just kind of giving you a little picture here of what was going on. So I walked up to the door, first time I've ever been there, knocked on the door, and I hear a woman's voice inside the house, but I don't quite understand what they're saying. A lot of times these home health patients just say, "Come in." So I knocked again, I hear this voice again, so I walked in. And when I walked in and looked around, there was nobody in sight. And over in the corner, there was a bird cage with a parrot, and the parrot did this. "Jennifer. Jennifer." I don't know who Jennifer was. It wasn't the name of this patient, but that's what the bird said. And I realized in a moment that it wasn't someone telling me to come in. It was that bird saying, "Jennifer." Right about that time, the patient comes around the corner with her walker. She walks around the corner and sees me and goes, "Ah!" and starts reaching into a bag hanging on her walker. And I was like, "I'm the home health nurse. I'm the home health nurse. Don't shoot me. God help me." And she stopped and swapped and became Mrs. Doubtfire. "Oh, well, honey, come on inside here. Come on, sit down." So I walked and followed her in as slow as she could walk. She plopped down in this recliner. And just looking at the way she was moving, I know she ain't getting up and down pretty quickly, right? So she sits down in this recliner that's just molded to her body. And I sit on the couch next to her, and she's so nice. "It's so nice to have you here, young man." All of a sudden, out of the couch appears two dogs. I don't know where they came from, but they were those little dogs. Those, I'm not a big person on tiny dogs. Now, if they're good dogs, that's great. But you know what I'm talking about. Those little dogs that just think they are a 300-pound Doberman, and they just get right up on you and start. There was two of them. Right? I mean, so close to me, they were spitting on me. Now, this is a difficult situation for a home health nurse because I can't do what I want to do. I want to just go whap and just land them over in the corner. Well, you can't do that. That's not good business. And I can't just yell at the dog because then I'll offend this lady in her own home. So here's where I'm stuck in this spot. I've got to hope that if I ignore the animal, the homeowner, the pet owner will take care of the situation. Unfortunately, they don't most of the time. And so I'm sitting here listening to right there on my arm, and I'm just trying to write on my notepad thinking, "Lord, please let this lady say something to this dog." Both of them, trying to just wanting to chew my arm up. Well, she finally reacted. This sweet little Mrs. Doubtfire finally reacted, and this is what she did. I kid you not. Scared the mess out of me. All of a sudden, she goes, "Shut up! Shut up! I'm gonna kill you! I'm gonna kill you!" Just yelling at the dog, "Shut up!" I about jumped out the couch. And then over in the back corner of the room, the bird goes, "Shut up! Shut up!" How many times? And that wasn't it. Other four-letter words from this bird. I don't know how many times it's heard this thing happening in the house, but enough that it has learned to mimic it. And this went on. "Shut up! I'll kill you! Shut up! Shut up!" I was looking for a way to get out. And then I realized I got a nursing assessment to perform, so I start trying to ask questions like, "When's the last time you had a bowel movement?" "I'll kill you! Shut up!" I'm going, just writing stuff down, looking like, where can I roll and duck and get out into the street before something crazier happens than this? And that's when something crazier happened. The lady reaches down beside her recliner, down there between the coffee table thing and the recliner, and pulled out a fly swatter. And she couldn't reach the dogs, so she threw it at me and said, "Just hit him! Just hit the dogs! Shut up! Shut up! Shut up!" I'm telling you, it was the craziest one moment. I said, "I can't hit your dogs! Don't hurt me!" And then I finally figured out what to do. I said, "Ring! Hello! Hello! Yes! Yes, I'll be right there. I'm sorry, somebody's dying. I gotta leave." And I ran away. And I was walking out to the car, sweat pouring down my face. In the background, I'm hearing, "Shut up! Shut up! Shut up! I'll kill you!" But that's home health for you. That's home health at its best. So why don't you sign up today, become a home health nurse? Then you can have some stories. You can tell us some stories, some good ones.